Hi everyone, I'm Dr. Teresa Michelson, Director of the Counseling Center here at Embry-Riddle Daytona Beach campus. Thank you for spending some time with me as we talk a little bit about aviation and student mental health, specifically focusing on how to recognize and attend to student distress. So I thought I might start with just kind of giving some context around college mental health in general. What the graph is showing you right now is three different population groups, the 12 to 17, the 18 to 25, and the 26 and older. So from 2008 to 2020, what we are seeing is an increase in the percentage of students or people who are identifying with depressive episodes. So you can see the population most vulnerable right now is the 12 to 17 or 18 to 25. So you can really begin to see, probably starting around the year of 2011, 2012, when those two age groups really begin to kind of see a increase in presenting with depressive issues, depressive episodes, and depressive diagnoses. So we'll talk a little bit more about that in regards to some additional demographic information. So again, the black bar lines indicate the age groups where we're seeing high numbers of mental illness. This is in the year of 2020. You can see females are presenting with more issues than men, but all that implies is that typically women are more likely to report it than men are. That doesn't necessarily mean that women have higher numbers of mental health. It just means that they report it more often than men do. Kind of along the same lines of when we look at different ethnicities or racial identities, what we see here are white, Caucasian presenting or disclosing more mental illness, Black, Hispanic, and Asian kind of a little bit lower in those areas, but again, oftentimes within certain populations, issues around mental health are unreported due to cultural issues, due to stigma, due to shame, other issues that may prevent a particular population from reporting when they're managing or dealing with a mental illness. So just to kind of share that information. When we think about the topic as it relates to aviation, in particular our pilot training, what we know or what we use are these acronyms of PAVE, I'm safe, and then we could talk a little bit about what the hazardous attitudes are. But with PAVE, you've got pilot, aircraft, environment, and external pressures. So external pressures can be anything that is impacting a student's ability to kind of stay focused on what the task might be. So it could be things that are going on in a personal life, it could be family life, it can be, certainly the stresses of academics that weigh kind of heavily on a person's mind when they're trying to manage things. So those external pressures can feel very heavy at times. I'm safe is illness, medication, alcohol, fatigue, emotional, and eating. So again, those areas highlighted in yellow are typically kind of coexist with mental health, mental wellness, kind of in that same area. We know that at times when people are dealing with stressful situations, they might look to drugs or alcohol to self-soothe or cope. Oftentimes over a duration of time, if things don't resolve, those issues can actually worsen. So going from alcohol or drug use to alcohol or drug abuse. So fatigue along the same lines, when people are feeling stressed or they're overwhelmed or things are again, happening in life that are making it difficult to sleep, people don't sleep as well, or they might have nightmares or night terrors, which impacts the quality of sleep as well. So a person can feel fatigued. And then there are those who may get all the sleep in the world and they still feel tired because emotionally they're just feeling zapped from things that are kind of happening in their life. Same thing with eating. Oftentimes, when someone's dealing with either an eating disorder or body image issues or, again, stress that might be related to either overeating or undereating, there can be some additional medical issues that happen when a person is engaging in disordered eating in some way, whether not eating at all or eating a lot. So again, those all kind of coexist. And when we talk about hazardous attitudes, ideas or beliefs around impulsivity, machoism, the anti-authority, resignation, and vulnerability, these are all what they would consider hazardous attitudes when it comes to being a pilot. So we can kind of reframe some of those areas into a more positive framework. So when we look at pilot, personal practices, what is it that that individual is doing to really engage in some wellness practices, some self-care practices that's going to help them navigate some of those difficult situations or things when things come up. Aircraft, same thing around awareness and attitudes. What beliefs do we hold that are going to support us in times of difficulty? Environment, what's our social networks like? How are our relationships with our friends and family? And how do we turn to them or use them for support when we need it? Which kind of goes along the lines of the external pressures, can also equal external support. How are we encouraging our pilots and those in COA to really seek out support and help when they need it, and to really kind of minimize the barriers or the stigma around that. So same thing with the hazardous attitudes, impulsivity. We really want them to kind of slow down, think first, not act so impulsive. The machoism, taking chances is foolish, kind of realizing that making good choices is always the best way to kind of navigate various situations. The anti-authority, follow the rules, they are usually right. The resignation, kind of establishing or helping a student to understand that they're not helpless, that they really can make a difference and make choices for themselves that are going to be productive and helpful. And then the invulnerability, the recognition and the maturity to realize that bad things can happen to them if poor choices are made or safety is not considered. So again, kind of shifting some of the mindset around that. So you might be asking, why are young adults even struggling right now? What's kind of going on for this particular population or this age group that are making things hard? So although the problems facing college students are complex, they have increased societal pressure to achieve success while not being equipped with the necessary life skills. So our students may not necessarily have developed the soft skills that are needed to really kind of navigate a different environment than maybe previous generations have been through. So young adults now are increasingly faced with negotiating America's culture of hyperachievement and the pressure to be effortlessly perfect. There is no room for error. There is no room for failure. So a lot of beliefs that if they fail, then they're less than perfect, and that just can't happen. Where we know developmentally and psychologically, we learn our best lessons in life when we fail. And so really kind of to help kind of change that conversation so that students do recognize and begin to see that failure does not mean inadequacy or incompetency. It just means an opportunity to grow and learn. So the rising cost of education places additional stress on students and their families. Youth are being pushed to their limits as early as elementary school, and as a result, their mental health and well-being are significantly suffering. Many middle and high school students have schedules rivaling top corporate executives with an average day beginning at 6 a.m. and ending past 10. So this demanding schedule leaves many sleep deprived with little time to develop basic independent living skills or soft skills, all while trying to figure out, who am I? Who is this person and what identities do I hold? So all of that can become very compounding and stressful and create anxiety. So in identifying distress signals, students who exhibit a combination of these symptoms or behaviors over a sustained period of time should be a particular concern. So things to kind of look out for in your classroom: sudden deterioration in academic work, any frequent absences or tardiness, inappropriate or disruptive classroom behavior, papers with themes of distress that might come to your attention, dependency, a student that hangs around you or makes excessive appointments to see you, any listlessness or lack of energy, falling asleep in the classroom, coming to class intoxicated or high, or any references to death or suicide, any expressions of hopelessness that you might pick up on. And then there are the physical changes, especially sudden weight loss or deteriorating personal hygiene. Any withdrawal or isolation from others would be an area to kind of be aware of and know that that could be concerning. Inability to make decisions despite your attempts to clarify and encourage them. Excessive somatic complaints, so things like complaining of headaches or stomach upset. High irritability or anger outbursts, any bizarre or strange behaviors such as unexplained crying or hearing voices, disorganized thinking, blatantly inappropriate comments or questions in class. That kind of creates discomfort or awkwardness. Any overreaction to criticism or mistakes, and again, any visible signs of depression or anxiety that you may become aware of. So there are some guidelines for how to interact with these students. So the following guidelines will help you communicate effectively with distressed students. So it's always a good idea to speak to the student in private at a time when you have adequate time to talk. So maybe not necessarily right before class, because clearly you'll need the time to get class started. But thinking about just how a person will need that time and the confidentiality to kind of share what it is that they're going through. So listen carefully and show genuine interest and concern. Reflect back to the student what you hear them saying. Refrain from critical or judgmental comments or questions that may throw the student off or make them feel uncomfortable. Do offer specific and non-judgmental descriptions of the behaviors that you're concerned about. So, for example, you might say, I'm concerned that you slept through class the last 3 times this week. What's going on? Are you okay? So again, always kind of coming from that place of concern and worry for the student often will allow the student to be more open in sharing what might be happening with them. So trying to determine if a student has a support system like friends or family, and if so, are they reaching out to those people? Involve yourself only as much as you feel comfortable, so be careful about getting too overly involved and some of your own personal boundaries around that. Describe the resources that are available on campus, such as the Dean of Students, Counseling Center, the Center for Faith and Spirituality, and give students a sense of hope that things can improve when a new plan of action is taken or additional support is being offered to them. If a student resists help and you are still worried, it's okay to contact the Counseling Center or the Dean of Students office and just ask for a consultation. Oftentimes, it's just kind of navigating those first conversations with a student and being able to engage them in some dialogue around what might be happening with them. So we can certainly help with that. So how to respond if a student is volatile. The following tips are provided in the event that a student becomes agitated or seems out of control or acts out. First and foremost, if you are feeling unsafe or are concerned about a student's safety, please call Campus Safety. They are available 24/7 to assist us when we're dealing with a situation that we may not be comfortable with. However, if you are feeling comfortable and safe, ask the student to meet with you outside the classroom so that you can speak privately. It's also important to remain calm during the interaction because your demeanor can prevent the situation from escalating. It may help the student calm down even more. So be respectful in your interaction, but set clear and firm limits. Saying things like, I can see you're upset and I want to help you, but in order to do that right now, I first need you to maybe sit down or lower your voice or whatever it is that you're needing them to kind of attend to first before you engage in that. So be patient and listen carefully to both the verbal and the nonverbal messages the student is conveying. Acknowledge that you understand their concerns and their feelings. Be concrete in identifying the presenting issues that you might have and suggest an immediate plan of action, whatever, again, the situation might be and what you're needing for them to kind of correct it. Encourage the student to accompany you to the counseling center or to the Dean of Students office to further discuss the situation if they're open to it. Again, this is not a punitive action. This is a supportive one. So just kind of communicating your intent behind that recommendation might be helpful to help them, again, just kind of disarm them and not feel so defensive around them. Respectfully inform the student of possible consequences should they continue to behave or act inappropriately. For example, making them aware that they may be dismissed from class and the consequences of that. How you may have to contact campus security as well. So just making sure that they're informed of those things that may happen if things don't de-escalate. So when to refer a student to the counseling center, you might start by asking yourself these questions. Does the student present as a problem or request information that is outside of your range of knowledge? Do you feel that the personality differences between you and the student will interfere with your ability to help the student? Do you feel uncomfortable dealing with the issue or problem that the student is presenting to you? Do you notice that the student is hesitant to discuss the problem with you, or do you feel that your attempts to help the students have been ineffective so far? In the moment, do you lack adequate time to listen effectively to the student? And are you recognizing that the student is becoming too dependent on you? So these are all questions to maybe ask yourself in considering having that conversation with the student about accessing resources such as the counseling center. So just something to kind of be aware of. Other considerations when making that decision: whenever students show an interest in talking to someone about their concerns, you can suggest speaking to a counselor, the chaplain, or a trusted friend or family member. Again, anytime a student is willing to engage in help-seeking behavior, that's a really positive outcome. We want to encourage that and give permission for the student to really engage in that. Some students will willingly consider your advice and come to the counseling center, but sometimes students feel that their problems must be extreme in order to receive counseling. They may be kind of rationalizing or feeling like their issues aren't severe enough for them to come and talk to somebody. Or there may be fear that there's consequences to seeking mental health services. And we know this to be true, especially with our pilots and concerns with FAA regulations. But unfortunately, as many as 75% of students who struggle with depression and anxiety, they're reluctant to seek help. And this really increases the risk of the harmful outcomes such as dropping out of college, poor academic performance, suicide, and increased substance abuse. So we really, really want to send the message to our students that it's better to deal with their concerns now before they become more serious, and really as it might impact them in their profession once they graduate and move on. So additionally, it might be helpful to ask yourself the following questions to help confirm if a referral to the counseling center is appropriate. So asking yourself, can I help this person in a relatively short period of time? I'm considering what my responsibilities are, my role, and my skills. Is this person's behavior staying the same, or is it getting worse? Are things really not improving for them? Is this person's behavior placing anyone, including themselves, in a life-threatening situation? Am I unable to stop worrying about this person? And is the worrying affecting my mood and my ability to function? Or have I discussed and asked questions about what is going on in the person's life as opposed to just making an immediate referral? So again, sometimes we don't want to over-pathologize just a normal reaction to a distressful situation. So all things to kind of consider when talking with a student about resources like the counseling center services. So the Counseling Center provides free and confidential services for currently enrolled Daytona Beach students. We strive to provide the following services in an atmosphere that is welcoming, comfortable, multiculturally sensitive to all students. So we offer brief, solution-focused individual counseling. We also offer group counseling if both members in the relationship are enrolled students. We offer group counseling, drop-in workshops, consultations, urgent crisis services, case management for students who may not necessarily want to seek services here at the counseling center. We can work with them to find a provider in the community for them as well. And we work with our community to engage in other types of outreach and preventative care, as well as the greater area where we work with our community providers to help with referrals as well. So one resource to make sure that you are aware of and that your students are aware of, it's called My SSP. It is an app that students can download onto their phone. They would use their Embry-Riddle email address to connect, which provides them with free access to the resource. But it is a chat, phone, and live virtual counseling or a clinical person who could be available to work with that student 24/7. It's wonderful because it also offers resources in about 30 different languages, and it can be used worldwide. So the student is visiting over the break back home in Spain, but they're needing some additional support in that moment. They are able to use the app and connect with somebody in real time and in their primary language. So make sure students are aware of this as well, so they can use it whenever they need to. So where is the counseling center? We are located right next to the health center in the wellness complex. It's building 502. We are open this fall and into spring, Monday through Friday, 8 until 5, and our summer hours, which are ending shortly, Monday through Thursday from 7 a.m. to 5 p.m. and we close on Fridays. Definitely check out the Counseling Center website through Ernie. Lots of additional information is on there, including some self-help videos, handouts, and more information about our clinicians in general. So definitely check that out. Other campus resources include our wonderful Center for Faith and Spirituality, our chaplain's office, and our incredibly helpful health service area as well, which is right across the breezeway from us. So just be aware of those resources as well. And in addition to this presentation, we have created a faculty toolkit. So right now it is in production, but it will shortly be available to all faculty and staff by the start of the semester. So we'll be sending that out shortly as well. All right, so that kind of wraps it up. Again, if you have any questions about any information that was presented in this presentation, please do not hesitate to connect with me or someone in the Counseling Center. We are here to help support our students, number one, and to certainly help you navigate any of the interactions that you have with students as well. So take care and thank you very much.